Do you know what glaucoma is? And are you interested in knowing more about the socialization of this disease in Indonesia? Then welcome. I am Fiolita Medina, a student of LSPR Communication and Business Institute from Mr. Charles Bonar Sirait's Public Speaking and Presentation Skill class, PR23-EXCL. During this video, I'm going to explain to you the assignment that Mr. Charles gave on creating a journal with the main topic of public health. So, for the journal on coursework 4, my group, which is the group 4, that consists of me, Fiolita Medina, Almira Divayani, Devia Guidia, Kayla Sylvania, and Raisha have chosen the topic of eye disease, which is still related to public health. First, you might be wondering, what is exactly public health? University of Pittsburgh Graduate School of Public Health defined public health as the science of protecting the safety and improving the health of communities through education, policy making, and research for disease and injuries prevention. The World Health Organization itself defines public health as the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. The World Health Organization also stated that public health is really important because it has the vision to promote greater health and well-being in a sustainable way while strengthening integrated public health service and reducing inequalities. In order to achieve this vision, the approach of public health must involve working with other sectors to address the wider determinants of health, and with the help of health professionals. As a communication student of LSPR, who has a mission to support the vision of public health by the World Health Organization, my group chose the title of JCI Hospital and Clinic Strategic Communication on World Glaucoma Week Campaign 2020 to educate the dangers of glaucoma, because by doing this research, we can implement their socialization in order to educate the public about one of the eye disease in the public health sector, which is the second threat to blindness after cataracts, and that is glaucoma. Our research is actually still ongoing and it has not been completed yet, but we have managed to do the introduction, research and methods, result, discussion and conclusion, which is actually so close for it to be complete. Before we go on to the topic of glaucoma, let me ask you, do you know what glaucoma is? The United Kingdom National Health Service defined glaucoma as a common eye condition where the optic nerve, which connects the eye to the brain, becomes damaged, and is usually caused by fluid building up in the front part of the eye, which increases pressure inside the eye. The main problem of glaucoma is that it can lead to loss of vision if it's not diagnosed and treated early, which is why socialization regarding glaucoma is really important. Based on the data conducted by Masita Dewi Sari from University of Northern Sumatra, the number of glaucoma sufferers in the world is expected to increase from 64.3 million in 2013 to 76 in 2020. In Indonesia itself, every 4 to 5 people from 1,000 population suffer from glaucoma. The highest prevalence of glaucoma in Indonesia is in Jakarta province, which is 1.8%, and West Sumatra in 1.14%, and the lowest of glaucoma prevalence was found in Riau, which is 0.04%. This is why socialization on the topic of glaucoma is so needed, because this disease could affect so many if underestimated. But the great thing is, there is a hospital in Indonesia that realized the importance of taking this disease seriously by doing a campaign about glaucoma for the past 2 years from 2020 to 2021, which is JCI Hospitals and Clinics. JCI Hospitals and Clinics is an eye specialist hospital established on February 1, 1984 that has international service standards. JCI Hospital held World Glaucoma Week for the first time on 8 to 14 March 2020 and began to continue to hold the second Glaucoma Week campaign the next year. The Glaucoma Week Campaign 2020 is filled with so many interesting events to make the public attracted to participate in the campaign. This event includes seminars with professional doctors, and also GIC hospitals and clinics provide GIC Glaucoma Suite, which is a comprehensive and modern special service for glaucoma patients. GIC Glaucoma Suite provides many types of service, from education to consultation, diagnostics, and medical to surgical procedure, which are available at JCI hospitals and clinics in Menteng. The importance of glaucoma is something that needs to be more socialized in Indonesia, since this disease itself will be so dangerous once it is too late to be treated. By learning about GICI hospitals and clinic communication strategy in the Glaucoma Week campaign, we could reach the vision of public health that has been stated by the World Health Organization, which is to motivate other health professionals in taking an approach in public health in order to promote greater health and well-being in a sustainable way while strengthening integrated public service and reducing inequalities. That's all from me. Thank you so much for watching, and I hope you stay healthy during this pandemic. See you soon!